All right, I'm Tyler Van Winkle, and I'm going to do the final check-off for vital signs. First, I will verify, interpret, and evaluate the physician's orders and protocol. I will then scan the chart for any pertinent information that I need to know. I will wash my hands and apply some disinfectant. I will gather the equipment needed and assemble it, and then verify the function. I will check to see if there's any malfunctions with the equipment. I will then apply any PPE that is needed to go into the room. I will then verify the patient, introduce myself as well as my department, and tell the patient what the procedure is, making sure that they understand it. I will then position the patient in the correct position for the procedure, and then I'll start assessing the patient. So in assessing the patient, I'm going to do the vital signs. First, with vital signs, I will make sure I will locate one of their pulses. Usually it'll be the radial pulse that you'll use. You'll do 15 seconds. If there is any abnormalities that you see, go for the full 60. And just make sure you're kind of seeing if there's any, how the pulse is, if it's a good pulse or not. After you get the pulse, you'll move and we can do the respiration rate. For the respiration rate, you'll just watch them breathe for 15 seconds. Again, any abnormalities, go 60 seconds. For this, you're just going to also kind of see if there's any hard breathing, any nostril flares, or if they're really struggling to breathe. After respiration rate, you would do the Spock sensor, or the SpO2 sensor. We don't have one, so we'll do that again at a later time. After that, we can look at, the cardiac monitor, making sure everything kind of is matching up. Usually on a cardiac monitor, it'll kind of tell you the respiration rate and the oxygen saturation. From there, we'll go and we'll do the blood pressure. After we finish the blood pressure, which we don't have blood pressure cuff, we'll do that at a later time too. We will check through the chart to note if there's any temperature, if they have a temperature or anything like that. After that, we will kind of see if we need to reassess or re-instruct the patient to do so if we missed anything. Then we'll make sure that maintain safety and comfort of the patient. Then we will go and we will take back any equipment. We will remove any waste and wash our hands. Then we will make sure to record all that data, and then make sure that you see if you need to tell a physician or anything to get any recommendations and how the treatment is working.